Good morning, Madam Singapore, all guests for this symposium. I'm actually very honored to start this lecture for this symposium. Obviously, I am a doctor by training, sometimes driven by profit from drugs, sometimes driven by results. But I think one of the things I realized as a doctor and as a medical practitioner, or sensei, what we call it in Chinese, which I do as well, is actually to manage patients. And after practicing for good 20 plus years as a doctor, some things do come into realize that are we managing things correctly? I've read Ms. Betty Khoo's books as well on how certain different ways we can manage disease. So is disease about taking a pill? Is disease about making you feel a bit better for a short while? Or really, do we really understand the treatment per se? Every time you see a doctor, they don't really tell you to drink more water or to do exercise more. They just give you a pill, take something, and then you get better. So I thought I want just to share with you some of these perspectives that I have together with my practice, and of course some integration into the Western Chinese, and see how we can actually share this together in a short session. Can I have the next slide, please? Now, I think some of the more common disease that we see recently, and of course it's actually incorporated to the Ministry of Health as what called chronic disease management program, whereby you can use the MediSave to claim, and that usually means that you have enough of numbers in Singapore that is causing this problem. And henceforth, are we then seeing, are we then approaching it correctly in that manner? Next, please. I will start with hypertension. I think as a study from ministry, there's about 15% of people above the age of 55 in Singapore actually would have hypertension. It's fairly high numbers. Okay, you walk around, every 10 people, 1.5 of them have hypertension. And of course, if you ask a doctor, if you seek management, and the usual thing that you will see is check your blood pressure, take a pill, and go home. I'm quite sure you have friends, and they do that month by month, every 2 months or every 3 months, type of thing. And really, if you really ask them, why are you taking the pill? They say, yeah, my blood pressure is high. So, what's wrong with having a high blood pressure? It's just a number game, isn't it? So what if it's 190 over 100, or 140 over 80, or 120 over 80? So to them, they are feared by the number. And of course, I think with more education, we realize that hypertension perpetuates us with higher risk of getting other disease, like complications of the kidneys, strokes, and heart attack as well. So this our treatment plan as a Western medicine is about taking medicine, about preventing complications. Next, please. I thought one of the first things that when we're in Kampung Senang, and we should start is of course diet. And in the last few years, there is this thing called DASH, which is Diet Approach to Stop Hypertension. So it's DASH. And in fact, this has been something that's fairly recognized. I think it's in the state as well as NIH, and it has been proven consistently that it can actually reduce blood pressure on this diet. Of course, it actually encourages a lot of things that we talk about, being healthy, whole grains, nuts, and things, and low sugar diet, lowering consumption of sugar, meat and sweets, and so on and so forth, and rich in potassium, magnesium, and calcium, and lots of fibers. So we realize that whilst we believe in certain things, they are not unproven. 10 years ago, when I came into Kampung Senang with Joyce, we wanted to do something, but I always sometimes resist. I thought there's no real basis. I know you feel good on this, but are you sure it's good? Are you sure you can promote this? I think as a doctor, we feel that we need a thing to explain to patient. But I think if we don't even want to believe, That is, it's going to be our stumbling block. And I think all over the world, they are realizing that even simple things like diet is helpful to actually have to control your hypertension. So it's not just about taking a little pill that have to bring up blood pressure. And of course, I think henceforth, are there other things that's useful? The fasting, the juicing, are they really useful? And I think the recent study in treatment for hypertension has said if you can reduce your abdominal girth, which is your waist diameter by 2 inches or 1 inch, you actually can reduce the blood pressure by another 5 mm of mercury as well. So we realize that certain things which we thought, it's just been getting healthy, making you feel good, may not just be that. It has got some treatment therapeutic, and it is actually proven with proper studies as well. Okay, next slide please. Okay, so I thought with that understanding, so we know that there is a natural way, and of course as a practitioner of Chinese medicine, I thought I just want to share with you how then do we add that into the management of hypertension. Now, I'm just going to share you some of the things that I always tell a lot of my fellow colleagues when I give lectures and my patients. Now, if you see 2 persons, one being a big, plump, loud person, and another person that is small, frail, and a little bit breathless, and wear 2 jackets, and both of us walk into a doctor's clinic, and we measure a blood pressure of 180 over 100. Both the same. Assuming all other factors being equal, means we have no other problems, no diabetes, nothing else, the likelihood of us getting the same pill for treating hypertension is going to be very high. I think we know that. We are customizing treatment. I don't care whether you are big or small, but do you really think that a big size guy and a small size person should take the same medication? This person will probably wearing a singlet and sweating all the time, and they're not wearing 2 jackets, which is feeling cold, We have seen such treatment before. And I think as treatment per se, we don't discriminate. We look at the reading of the blood pressure. You match 180 over 100, you are hypertensive, there you go, the pill. So and I think that is the treatment that we are seeing. So hence I feel that it is apt that when we look at what we call holistic treatment, believe that you are different from anyone else, and there is a difference. So and it's the same thing for Chinese medicine. Even for Chinese medicine, we then subdivide people into what we call yin or yang attribute, and hence in that manner we customize, or we actually give them the appropriate treatment. And I think maybe that's something that we will think of as well. Do we then juice the same juice for everybody? Some people takes very well with juicing of certain type of juice, but some don't. So you may have to then modify, and not that everybody will be okay with certain type of juice or certain type of medication. I thought with this, I will shortly show you some of the Chinese medicine that actually has been told to be useful in hypertension, and are they useful for all? Next, please. Okay, so I just this slide shows you the relative difference. There are people who are hypertensive and they are loud, they are flush, and hence the treatment is actually what we call clear the excess of what we call exuberance of your yang. Next one, please. And of course, as I mentioned, the other small size person that usually is weak, it's actually lethargy and afraid of cold all the time. So do we then manage the same things? In fact, in Chinese medicine, we don't. Next slide, please. Okay, so I'm coming to my first herb that I just want to share with you called chrysanthemum. There are a lot of people who believe, and that's true, it's been proven, that chrysanthemum is useful to reduce your blood pressure. If you Google PubMed, which is one of the fairly well-known research studies for Western medicine and also for natural herbs, it is proven that chrysanthemum is useful for a fair group of people. But the thing is it useful for all? So if I were then to ask you the same question again, the big size person here and the small size person here, who would be more beneficial to take chrysanthemum and to lower the blood pressure? It will be the big size person, because it's excess. Now, all of us know chrysanthemum is cooling. Cooling is actually clear excess. It takes away the excess. So hence you want to actually rejuvenate by clearing excess, and hence you achieve a balanced type of situation. The other person may not work as well. So in my younger days, I used to remember my grandma would tell, at her age, when she's hitty, she cannot take too much of cooling stuff because it makes her knees go weak. I don't know whether you remember. And they can only take a little bit or they take something else. So hence, you realize that there is a body attribute to certain things. Alright, so in this aspect, perhaps for looking at the holistic approach, we should remember a disease treatment is not just by disease. I.e., if it's hypertension, you don't just look at hypertension. It's also looking at a person attribute. You don't just manage disease purely on medications. There's a diet, and of course, there is even if you consume Chinese medicine, we manage it differently. Henceforth, even if you take Western medicine, do you really think that all Western medicines are the same? That for sharing, there is this medicine called propanol or atenolol, which is what we call the beta blockers, that we use usually as a first line for hypertension, and that actually slows your heart rate a lot. And that's actually a medication that is useful to actually, for the big size person, that is actually what we call excess. You want to slow him down. So sometimes some people take certain hypertensive medicine, they tell you, I feel more lethargic, I feel slowish. Such medicine is very good to be given to the big size person and not that small size person, because it will make her even weaker. I mean, I think that if you then interpret this, you actually can understand that if you want to manage a disease in a proper trending, we should remember that this should be a holistic approach. Next, please. Okay, so that's the other one that actually what we call Golden. It also has an effect to what we call open up the arteries and hence bring down the blood pressure. I share this because the other thing is that it interacts with some of the medication that we use called calcium channel blockers. For those who actually are unfamiliar with Adelaide, the Novas, the type of things, actually they are the Novas amlodipine and Herbacil. And so these are the various medications that you will actually interact with. So where do I come from? While we want to manage a person holistically, certain things also clash. While we are going for your management, even for other things, not Chinese medicine and Western medicine do clash, all of us know. But do we really think that other management of even vitamins, even juicing, will they clash? There might be a chance. So I would want us to listen to your body. I remember Betty who used to tell me, our body tells us, what we need and what we want. So I think I fully agree. And I've since forth never ignore my patients when they tell me they're unwell. Okay, so I think that's something that we have to remember. That there is interactions with certain herbs and drugs, and also other treatment. So please be aware as well. And once we walk into this path of holistic management of ourselves, of your family members, of your loved ones, of your friends, remember all these things should be taken into consideration. When I first started Chinese medicine, this thing about Chinese herbs are not natural. No worries, they will never interact with anything else because Western medicine is chemical. So we know it's not true, hence, and then there's a lot of drug-herb interactions that's been reported all over the place as well. Next, please. Okay, this is the other category, okay, 度重. So this is a tonifying one, and again, it has got blood pressure lowering effect, and this will be effective. 度重 is actually a equilibrium bug. It's actually a herb that nourish your body. When that nourish your body, for some people, it does bring down blood pressure, and we realize it will bring down blood pressure for the people that's weakened. So for that big size person and the small size person, so this will be used for the small size person. that is weaker. So hence you realize that we have to address the management of disease in that manner, whereby we then understand this in a better manner. Next slide, please. Okay, so the rest, I just want a few of the others. So Ge is actually the other herb that we use to actually reduce blood pressure. It has got some interactions with some aspirin. So if you're on aspirin, you may want to be careful because it will enhance the bleeding effect of aspirin. Next, please. Okay, so that, and of course, in that management, there are things that also oppose hypertension. Some herbs cause hypertension effect. So you also must remember that you cannot just take anything as it is. Right? So you also should remember that sometimes while you are embarking on some treatment on yourselves, and so on and so forth, if your disease gets worse, of course it can be a transient. We know that sometimes this detoxifying effect, you do feel worse for a short while. Monitor that, and if that doesn't go away, then you should remember that then sometimes it's maybe a counteractive effect. So I chose one or two herbs that has got some of this. Chuanwu is a very rarely used herb. It was first used in China, it's aconite roots. It's actually first used in China as a abortion drug. Abortion herb, I would say, no, it's a drug. I mean, the early days in Chinese, they used that to actually abort unwanted pregnancy. But of course, it was found to be very useful to actually treat rheumatoid arthritis. So, in fact, when I was presenting this slide to Tan Tock Seng doctors 2 years ago, one of the head of rheumatology, Professor Cheng, his father was a TCM practitioner, so he admitted that his father used a lot of this herb as well. So, but it's a bit poisonous, it will cause some numbness, and it does bring up your blood pressure. Okay, so even if it's a natural product, it can also sometimes worsen some of the effects of your current chronic disease. Next one, please. Okay, so the other one is ginger. Ginger, we know that it does also improve or increases your heart rate, and it indirectly actually increases the blood pressure. So I think you know that. I think a lot of ginger, you feel this heatiness, your heart beat faster, and yes, you are more flush as well. So some of these things has been actually shown to interact with some of the disease and the current management. Okay, next please. Okay, this is the last one for the Chinese medicine. Herbal acrimonia. Okay, this is one of the herbs that we use a lot in Chinese medicine for the management of cancer. It actually has a lot of therapeutic effect to actually limit cancer cells growth. And infusion of these herbs actually do show an increase in blood pressure due to constriction of blood vessels. And of course, it does cause flushing due to this constriction. And in that manner, result in a hypertensive effect. So with this broad sharing of the various management of hypertension using herbs, using Chinese medicine, and I think Western medicine is a given that I'm not going to share very much. I think this is actually orthodox treatment. I want to actually share with you there are various looks into certain simple things that we understand. So of course I didn't touch lifestyle because I know there are other speakers who talk about lifestyle, that they are the experts in some of this, and so we all know that the various stress relieving things and other things do also relieve blood pressure as well. So I think, remember, no one disease is best managed by one type of treatment. Really, if there's ever a branch of medicine, mine is the best, and mine can treat, I think then it's actually very mild. And if that is really the case, there's no need for any other existence of anything. I always tell my patients, really, if Western medicine can't be that bad, because it does help people. So with Chinese medicine, I mean, I don't think it's just about. My lecturer used to tell me I make patients eat grass, jia cao, because I give that. And I think that's very anti-Chinese medicine. And of course the other things, even for all this fasting, juicing, diet, and I think we cannot ignore the fact that it's useful. I'll then share briefly with you the next disease called diabetes. Next please. I think you can skip this. Yes. Yeah, okay. I think diabetes is something fairly interesting. It has gone through so many different types of understanding since my days as a student and my days as a junior doctor, and so in short, there is something wrong. Okay, about diabetes. Diabetes, of course, is in China is actually sweet urine disease, 糖尿病, yes, yeah, sweet urine disease, and of course, the name come about when they realized that the urine of I think one of the animals, which is dog or cat, which actually found to be very sweet after they removed the pancreas. So, what actually is the cause of diabetes? We all know diabetes is when you take your blood pressure in the blood sugar in the morning and it exceeds a certain level, 120 or so, or if it's after food, it's more than 180. I think it's diabetes. But really, what does it? And so what if your blood is sweeter? Isn't it good? I'm sweet. I'm a sweet person. So everyone should be happy about me. So again, so what is really wrong with some of these understand? So I think we don't really sometimes, or some of my patients don't really understand some of this. So while we look at diabetes per se, I think the long and short is that our body has got not enough insulin, which is a hormone, to actually reduce the sugar in the bloodstream. So if you look at this way, in the past, it's always look at, oh, okay, if your body has too much sugar, and insulin is responsible to reduce the sugar into your bloodstream. So if you have diabetes, it will mean that you have not enough diabetes, not enough insulin. Simple equation, isn't it? So henceforth, in the past, it was always that I want to stimulate insulin. Got more insulin, then sugar will go. But then the rest, things are not happening. I stimulate more insulin, the insulin seems to work. Then the rest, maybe the insulin is now not as strong, which is possible. So now it's like 10 good soldiers and 20 half-baked soldiers. They are the same. Okay? So if 10 half-baked soldiers is also not that great now. So and hence we move on to what we call the insulin resistance. And there has been a lot of studies to find that if you are overweight, if you have a certain caliber, your insulin becomes less effective. What we call insulin resistance syndrome, which we talked about metabolic syndrome. But then we realize, so diabetes is not just about the balance between insulin and sugar. It's also about how, if I may use the word kilat, which is how efficient your insulin is to actually work on the sugar. And also lastly is your body ability to accept this insulin to work. So there are various factors on that. So again, the management of this are the following. Okay, weight loss is understood because adipose tissues has been known to block insulin action. So if you have more adipose tissue in your body, your insulin will be blocked, and even if you have a lot of insulin, they will not be able to work in your system. They will not be able to reduce your sugar. Okay, lifestyle changes, okay, that includes all the other stress management. We understand that that has an impact on some of this as well. Diet, okay, I think diet is something that is, if we ask a lot of people this diet, okay, we just reduce diet, 1,005 calories, 1,008 calories. I mean, when I was hospital, all diabetic were given 1,005, 1,500 calories because diabetic. But I think, is it really just the calories, or is it the food? Or of course, medication. Okay, next slide, please. Yep. So and of course, this one of the I even put the date. This August 31st, 2009. And there are actually many types of diet about diabetes. Of course, I mentioned lowering cholesterol, but I think this Mediterranean diet, they have also other things. And again, it has been shown in Lancet and New England Journal of Medicine that this diet, such as, again, you realize not much of dash, which is a diet high in plant food, fruits, nuts, legumes, cereals, olive oil as a primary source. Nothing about reducing calories. You realize, so you see, there is a shift of some of these things. I just want to share this with you that, things that, even with myself, as soon as I share with myself, things I've known 10 years ago, 20 years ago, might have changed. And it's not just, it's not just, I think it's that it's proven. In the past, it was, I think, it's like this. When Joyce would tell me to do this, I said, okay, but that's what she think. But now, I think these are being proven. You know, again, that some of these things are a method to actually treat the disease, not solely on medications only. Diet, as I said, and that's some one things that Kampung has advocated is a very important management or approach to disease management. So you have a DASH diet, and these are not about the conventional low salt, which is what all of us know for diabetes, or low calories. In fact, we realize to convert into other things, healthier things, more wholesome things. You can actually reduce blood sugar, and this is found, as well. Okay, so on top of blood sugar lowering medication, the diet actually helps to reduce the diabetes. Okay, next please. Okay, then I will talk to Chinese medicine. In Chinese medicine, it's very interesting. Chinese medicine never actually understood diabetes per se as diabetes. They understood it as what we call diminishing and thirsty, 消渴. Purely by symptoms, they find that diabetic patient diminish in size, which gets skinnier, and that's early stage diabetes, and they actually get very thirsty. So 消 as in reduce, 渴 as in thirsty. So the Chinese medicine first described or first coined these symptoms in BC 300, and they actually says that this person keep feeling thirsty and gets skinnier and has a lot of passing of urine, and the urine appears to be sweet. If for those who understand Mandarin, that's why I say 味甘甜如蜜 means as sweet as honey. Okay, I wonder who tasted that. Okay, but okay, that's just a description, of course. Okay, next please. Okay, so I just mentioned. So the understanding, of course, in those days. So we have a modern understanding. What are the earlier understanding of Chinese medicine? So then the TCM approach, they understood this, or the pathogenesis of this 消渴症 as inappropriate diet. So they also understood that if you eat wrongly, or certain food, it will perpetuate diabetes. They also understood that inappropriate emotional strain, that you actually get too stressful or too angry easily, it does sometimes perpetuate diabetes as well. Severe exertion. Some disease in Chinese medicine believe that if you overexert yourself without proper rest, you also go into some disease, and diabetes is one of them. And of course, chemical poisoning. In those days, they do have some lead, and they do high lead content in some food, and these do actually poison the system, and they also do diabetes. So we realize that even those early days, so we are not new. While we understand the emotion, diet, and even appropriate rest is important as a holistic treatment, people in those, as I mentioned, 300 BC ago already understood. They actually suggest that this could be some of the cause, and of course the management is to reduce some of this. So we are not inventing something new. We are actually rediscovering, and I think rediscovering and also redefining and confirming that it's true and it works for the disease. Next, please. Let's press again. I think it's more like that. Okay, next, please. Okay. This is just a description of the TCM way. They divide the 3 portions, whereby you are mainly thirsty first, or you actually have a lot of thirst and a loss of weight, and lastly a lot of thirst, loss of weight, and keep passing of urine. So they are just severity. So we understand that if diabetes gets worse, it affects the kidneys, and you lose weight, you have back pain, and you have got kidney problem. That's the worst form, because the earlier days you just have some dryness of your mouth, nothing else, just feel thirsty. Okay, so that's where we come about. Next, please. Okay, so this is treatment. I won't talk very much treatment, but instead I just talk on prevention and how we link on into holistic care. One of my studies that I do in Nanjing when I was doing my master was actually on diabetes. As I mentioned to you, diabetes is about being thirsty. I think a lot of us know that. And if you feel thirsty and you go and tell a doctor, I'm thirsty for the last 2 weeks, the first thing you do is the blood sugar. And I think if the doctor don't do, doctor is not very good lah. And if your sugar is normal, what doctor tell you? Drink water. Nothing else to do. Which is correct. you are thirsty and your blood sugar is normal and nothing else, drink water. I mean, that's how to answer. Then you say, but excuse you, thirsty. So we're in China. So what we believed, so which I think is very apt for this holistic care, was, do disease happen overnight? Normal blood sugar, i.e. you don't feel thirsty. Abnormal blood sugar, i.e. you feel thirsty and you're diabetic. Is there in between where your blood sugar is normal and your body cry for help, that you are thirsty and yet you are normal? So in this interim, I call this functional abnormality as opposed to a structural abnormality. So was my 3 years in China, what I did was actually, well, first we have volunteers. We actually advertised in papers and said, if you are thirsty for, I don't remember, I think 3 months, persistently, come and see us, we give you a free consult, So of course all this, I think 200-ish people came, half of them were diabetic, okay, so they got diabetic, okay, so we sent them for treatment. And another half was non-diabetic, but 100 or death, 110 of them. And what do we do? So we say, okay, do you want to then embark on a management of your health? Of course, in Chinese medicine, whereby we then balance your system and we see how things go. Of course, I foresee it. So half of them were given management, of course, in terms of Chinese medicine. So what we call, we nourish your body, we advise you on lifestyle. We also balance, so if you're deficient or excess, we balance that appropriately. And the other half, as we always say, drink more water, and that's it. So we follow them through for 1.5 years. Surprisingly, the one that drink water, 1/3 of them develop diabetes henceforth. And only less than, I think 8-point-something% of those who actually manage as a holistic care went with diabetes. So that's actually an interesting study. And of course, we realize that so there is a component of disease that can be preventable. So again, sometimes you thought, you thought that you had these headaches, okay, never mind, go and check, and you say, okay, I'm okay, I don't need to do any exercise, I don't need to do any program. But you forget that your body may be crying out for help. You forget that this may be a functional change that's happening. So, of course, my take-home message here will be then, we should live on a balanced, holistic care for ourselves, because it not only can manage disease, it can also prevent disease that is coming your way. Which I think I showed you in these little studies that we have done. Okay, can just, next please. These are just some treatment. Next please, I will touch on this. And next please. Okay, so these are just some Chinese, oh goodness. Okay, some of the Chinese medicine treatment for diabetes. Next please. Just press with some, keep going up. I think I just want to go to herbs. Okay, so there are also some herbs that has been useful to manage diabetes. First, ginseng. For those who actually have read 本草纲目, which is the Chinese pharmacopoeia for Chinese medicine, written by Li Shizhen, this famous Chinese physician. And if you are familiar with 本草纲目, open up 本草纲目, you see 人参 as a 上品 top. And you'll tell you, it does 2 things. 益气, which means tonify, it makes you more energized. And second line actually always comes 生津止渴, means it crunch your thirst. In my early days, I read, ginseng, crunch thirst. Water also crunch thirst. I don't need to drink ginseng to crunch thirst. Correct. I mean, then why is it so special? And hence, actually, which then did another study, we found that ginseng actually crunch thirst for those with persistent thirst, and hence is for those with diabetes. And hence, we actually then published a paper in Diabetes magazine that found that ginseng reduces blood sugar up to 25%. Okay, so it's quite significant. And what are the implications? Implications is useful, of course, I mean it's useful, but the other implication is, of course, when we take ginseng, ginseng is expensive, so we tend to take it first thing in the morning, before food. That's what, and we also understand a lot of diabetic feel being weakened, and they feel that ginseng is good for them, and they don't want to take ginseng. So what they do is wake up the first thing in the morning, brush their teeth, wash their face, take ginseng. Then they take their diabetic medicine. So before they take breakfast, they actually faint because the blood sugar is low. So you must understand, so if you are diabetic, perhaps perhaps you should actually take it after breakfast. Okay, so I mean, it's just a caution. So sometimes because I'm quite sure if you embark on some of this holistic care, you would advise some Chinese herbs as well. And I really don't want the patient to develop a bad effect and then they will never take that anymore. And I think it's a waste because that's something that's useful. Nourish the kidneys again is also useful to reduce blood sugar. Next, please. Okay, Yu Zhu. Okay, this is one of the herbs that I used in my earlier days to prevent or treat thirst. Yu Zhu has a very a good effect to reduce your thirst. Okay, and my dong as well as the other one. So this tool was one of the combination that we use to actually help to crunch the thirst, and it actually helps to reduce the incidence of diabetes for those people. Next, please. Okay, Bai Shu. Okay, next. Okay, so I think end of the day, I don't think we understood diabetes very well. Okay, really seriously. Well, although we know insulin is the cause from pancreas, is it really insulin quality, quantity, or resistance? So insulin is a reason, but have really understood that very well. Not sure. Is calories the only consideration? We have found that it's not true. There are diets that, as I mentioned earlier, that promotes more whole grain, and you can actually eat more than 1,008 calories, and you still reduce blood sugar. So there are probably other factors they're looking at. So I think lifestyle, and many other things would have helped. And I remembered one of our Kampung Senang members, which has passed away a few years ago, which I have quite close contact with. He was diabetic before, and he also had some renal and all that. He started growing his own vegetables. I think Joyce will know who I'm talking about. And he will go to the mountain and do a lot of singing or something, which I went one day with him as well. It's quite interesting change of lifestyle and diet. And he actually, from severe state of diabetes, which need insulin injection, to no medication. And I was worried. So I was doing blood sugar every week for him, and it was normal. So I think there are other factors. Of course, he is very strict, and just imagine he grew his own vegetables and he eat them raw. Gosh, that was my first encounter, and of course he taught me quite a few things in life as well. But I think that's some of the things that we actually have to understand. It's a disease that we have not understood very well. I think the last short thing I'll discuss is about metabolic syndrome. Next, please. Okay, metabolic syndrome is actually something that we have coined out the last 10 years. It was initially called Syndrome X. X as in unknown, X, X equals something, X is unknown in all things. So when it first comes, it's called Syndrome X because it is it's actually the component. They find that these are very common: hypertension, obesity, and high sugar and high insulin. Okay, with or without high sugar, high blood sugar, but you witness with high insulin. All these actually, this group of people have a predominance to actually develop a lot of other complications of disease. So we realize that certain things happen at one go. So if you have one, you have the rest in combination. It's like when you have one bad habit, you tend to do all the other bad habits as well. And that's how we actually see. And I think, I want to conclude this and understand that I think we have not been living very healthily, and a lot of us, so we are perpetuating a lot of bad habits, and we have put on some of these things: hypertension, obesity, and that drives on things. Okay, next, please. And actually the cause, in short, is about our body not being able to utilize our system's sugar from health, insulin, and the other things, and that is due to our body not reacting properly. And it's a whole range. It's a very busy slide, but it just tells us that one simple factor, like which I mean your blood sugar being not very responsive to your insulin, will then perpetuate to adipose tissue growth, perpetuate to lipids abnormality, and perpetuate hypertension. So just imagine one abnormality, you don't eat properly in one thing, it will just move on in that manner. And yes, proven metabolic syndrome is one of the things, or one of the concerns that medical science is looking at as well. Next, please. So these are just the various things, okay? elevated wrist circumference, high lipids, high blood pressure, and of course high blood sugar. And the rest is a lot of people with all this. It's quite frightening because we have one, we have all. So I think we have to actually understand they are not individual disease. They are linked to probably diet, to stress, and to lifestyle, and to many other things. This is the last slide. Next, please. Yeah. So these are just some of the approach that is suggested in the medical science. Very, very myopic. If you look at, they don't address other things. So, and that's why here we are today. I hope to actually address some of the understanding of disease, address some of the ways to make yourself more healthy, address some of the ways to prevent disease, most important, I think, and live healthily, and so that we can help other people. Thank you very much.
Thank you very much. If you could just stay on stage for a few minutes, we're not allowed to go yet. Can we have some questions from the floor before tea break? Who'd like to ask a question?
Dr. Swee, there's for diabetic, also it says that there's few types.
Yes.
One is hereditary,
yes.
right? One is normal diabetic.
Correct.
So what's the difference between the treatment of the two?
Okay, the one called hereditary one, this is the type 1. Okay, the type 1 are not very common in Singapore, it's probably genetic as well. You actually are born, your insulin is not secreted at all. That means it's the abnormality of your organ called pancreas, which is the islet of Ingham, is the cell that secretes insulin. It's not producing insulin. It can be genetic, it can be after a viral disease. And this is unfortunate because this means you have injections. Because you need external insulin to help to bring down your sugar. Whereas as opposed to type 2, it's actually your body has insulin. So insulin is either not enough, which that's what we thought, or insulin is actually not efficient. And not efficient, as I said, it could be blocked by fat tissues, or it could be other factors. So hence, we actually then manage it. That's why there are actually 2 types of medication that we use for this other class of. So for first type, the treatment is always insulin injection, nothing else. Okay. Second type, we can either stimulate the pancreas to produce more insulin. These are the sulfonylureas, which is the Deonil and whatsoever. Then there are other type of drugs that actually make your insulin more sensitive, the biguanides, which is the metformins, and so on and so forth. So these are the 2 class of medications that actually we use for type 2.
Okay, thank you very much. Any more questions before we go off for tea?
Thank you, Dr. Swee, for the insightful talk. I'd like to ask, what's your opinion on nutritional medicine? There is the use of, we heard there's chromium and I think cinnamon powder for treatment of diabetes.
Yes. Okay. If you ask me the question 5 years ago, I would say there's no evidence based and I don't believe. Okay. Now I'm older, I hope I'm wiser and I'm more acceptance to a lot of things. I think every time someone asks me something, this has been asked before by my patient, I will always look up and not say no. And chromium has been touted to actually be useful to maintain the lifespan of islet of Ingham cells in pancreas. So I think that's what I talk about. It's useful to help manage diabetes or even prevent diabetes. Some people say that. So it probably is the case. Not very well proven, but there are some studies to say that. It's like the early days where we say vitamin B is good for make your nerve more efficient. 20 years ago when I first started, it was like a myth. Today, it is a fact. So maybe 10 years later, that will be a fact. But yes, it is being talked about, and yes, it is being looked into. So my take on this is, if you do things like, if it's not too expensive, you can afford it, and some get very expensive. And 2 is, of course, if it doesn't cause you side effect, I would not mind you taking that.
Well, thank you very much indeed. One more question and then we're going to have to go for a tea break.
Thank you, Dr. Swee. I would like to know, in your experience when you work with people with diabetes, do they normally present, say, a particular emotional needs, or does it present in a particular meridian itself?
when I because maybe of my disease, my background, I tend to ask a bit more. For those diabetic that I see mainly, okay, I think because I remember I tried to then classify mainly into yin and yang or excess and deficient. I find that a lot of diabetic are what we call deficient, 虚症, and a lot of what we call nourishing herbs are effective. And I wouldn't say particular meridian, but I would say organs, which I think will be the digestive organ. They have all the digestive organ abnormalities, i.e. the bloatedness, what we call dampness accumulation, bloatedness, loose stool, and so on and so forth. So that will be something that I also sometimes document in my notes, so that I will manage in that meridians. I assume you're a Chinese physician, that's why you're asking the question.
Well, thank you so much. I think if there's any more questions, perhaps you can have a chat with Dr. Swee during the tea break. Before you step down, Dr. Swee, thank you so much. And I would now like to ask James Lowe, co-founder of Kampung Senang, to come on stage to present Dr. Swee with a small souvenir as a token of our appreciation. Thank you.